Thanks for about palliative care, and we are going to look at the experience of palliative care in Cameroon. Palliative care in Cameroon started as far back as 2006, and this was by a faith-based organization, the Cameroon Baptist Convention Health Services, at the time when HIV and AIDS was at its peak and many were suffering. In our country, in the little areas where it exists, we have the mixed models. We have the hospital base, we have the outpatients, we do home visits. And so it's just a mix of all of that. It started in Bansot Baptist Hospital and has moved to some of the major hospitals of the Cameroon Baptist Convention. And the government health services are also getting involved gradually. So far, we have trained over 2,000 healthcare workers and many community volunteers so that they can help us in the fight. In 2009, it was the time for the formation of the Hospice and Palliative Care Association of Cameroon so that it can pioneer activities of palliative care in Cameroon. Unfortunately, this organization has actually gone to sleep for quite some time. But then, what is palliative care to us in Cameroon? Palliative care is care for those with serious health-related concerns, and especially to those at end of life. And for us, it is all about holistic care. It is about being there for the patients and their families. It is about taking care of their pain, doing the dressing change. It is about giving the nutritional support. These are the things that are embodied in palliative care as we offer in Cameroon. It is also about doing something useful for your patient, communicating well, and relieving them of their suffering. It is about care to the adults as well as care to the young ones because each life truly matters. It is about care to those in crisis, those in war-torn areas, like has been the case in the recent years. So far, I am just indicating a map which shows the services that are available in Cameroon. If you look at it keenly, you realize that it is in the northwest and southwest part of the country where we have the bulk of the services. And unfortunately, this is the area that has been plagued by the ongoing socio-political crisis that has brought untold suffering to Cameroonians. This suffering started far back in 2016. It was simply a peaceful protest, but unfortunately, it escalated into a political crisis that has led to severe suffering, displacement, and lots of people with increasing palliative care needs. The effects of the crisis on palliative care are enormous. It has brought about a lot of financial hardship. It has brought about a lot of financial hardship and trauma, physical, psychological, to all who are involved. Initially, we were doing home visits when we started palliative care, but this has truly limited our efforts, and most patients are suffering when they cannot even reach the hospitals. We have a lot of ghost town days and people cannot move around. There has been an increase in the number of refugees running to Nigeria, coming around, and the internally displaced people. Morphine has also been a real issue. This is our major drug that we use for pain control, but the government policies are not really supporting, and especially in the advent of the crisis, they think that the drug will be misused. So the drug has been in so limited supply and equally inaccessible to many, and most patients are suffering. The hardship has been compounded by the coming of the COVID-19 crisis, which has brought about lots of suffering to personnel and even the healthcare facilities that are unable to cope. We're also noticing diminished or even absence of the international support that we had. I remember in 2017, the international team from Hospice Africa, Uganda came to Cameroon, but they were not able to visit the facilities because of the crisis. When Mercy ships arrived Cameroon in 2017, the intentions were also to go beyond, but they ended up just being around the coastal area because the crisis could not allow them. Doctors Without Borders, who have also been useful within the period, their, their duties have been terminated by the state because the state thinks more that they are conniving or working together with the terrorists. And so this is bringing about untold suffering to the patients that we have. I just wanted us to look at this keenly to see that in 2015, 2016, we had lots of home visits, above 1,600 home visits in a year. But when it comes to 2020, 2021, we realize that this number has dropped almost below half. Now we have around 600 patients. This is telling us that our work is actually going down. Even the patients we were seeing at the hospitals has actually dropped so significantly. But this is not because the patients are not there. There are more patients who cannot truly have this care just because of the crisis. What strategies have we then used during this difficult time? Yes, we have truly reduced home visits to minimal because it is not safe for health workers to get into the homes. I remember one of our workers was shot dead during a home visit and many others injured. So because of this, we have limited to doing just the minimal. And also, we have decided to get onto optimal use of the electronic platforms using WhatsApp, mobile phone consultations, continuous psychological support on phone. We're doing free online consultations. We're equally doing Zoom meetings with our staff because there are staff in areas that we cannot truly move to empower them as was the case before. Yes, palliative care is all about integrating services, and we are doing this more to just ensure that those who even go out for other services carry along a package of palliative care so that we can be able to meet needs of patients. For instance, those going out for screening for HIV also carry along the message of palliative care so that patients can actually benefit. We are also using the church approach because through the church, we are able to reach more people. So through our churches, we are reaching the people. We can easily meet them at the church and we can give them the support that they need. Also, knowing that doing nothing is not an option, we resorted to doing our local fundraising to see that even with the little resources that we can get, we can be able to help our patients. And that is when we brought in the strategy we call the 1,000 project. 1,000 in Cameroon is equivalent to $2. We are saying that you can use $2. The person giving gives without feeling pain, and it relieves the pain of someone who has palliative care needs. This is because lots of people have palliative care needs, There is no health insurance in Cameroon, and their suffering is enormous. But when we are able to even donate and sacrifice the little we are giving, it can help them a lot. This fund is helping our patients buy them pain medication, get material for dressings, and also sometimes support them with food and transport because you give medications and there is no food for the patient. So it's a small strategy and it has helped us a lot. If we look at the little statistics there, we realize that the donors have increased what has been given over the years. It keeps increasing. It looks small though, but it's making a lot of impact. Next slide. You look at it keenly, you realize that many people have actually benefited from this service. Cumulatively, we have over 756 people who have been assisted even by this little fund. We realize that if we continue to put hands together, we can do a lot for the patients that equally come our way. Next slide. So we are saying that there is great need for us, especially in humanitarian situations like what we find ourselves in Cameroon, to have the government involved so that our patients can benefit more. We are also intending that the international community, looking at what is happening in Cameroon and the challenges, should also be able to partner with us so that we can support those who are truly desperate and suffering. We are saying that if we continue to integrate palliative care at all levels and having it as part of our healthcare system, a lot will be done. If we look at the situation in Cameroon, palliative care is not part of the training for health workers, nurses, and doctors. But if the government, if the policymakers should put this in place, it will go a long way to help that those who have been trained in the various training schools, when they come out, they will be able to give holistic care to patients who need it because the burden is truly huge. Thank you so much.